Hi, I'm Dr. Elizabeth Harris, and I specialize in plastic surgery in San Antonio. I have many patients that choose me as their plastic surgeon because of my background in art. I realize that a lot of plastic surgeons say that they have plastic surgery artistry, but I think that my background is unique because I was first an artist before I became a plastic surgeon. I remember studying art when I was very young, and I learned oil painting as a child, carrying heavy wooden boxes of oil paints to local studios so that I can learn from different teachers different aspects of oil painting and drawing. I received an art scholarship grant and double majored in biology and art in college. My favorite art classes in college were figure drawing and sculpting, and my love of figure drawing was something that I have continued throughout my life, and I continue to perform this type of art to this day. With a science and art background, I initially considered medical illustration as a career. My father was a physician, and I had influence from him, and this was further developed as I worked as a nurse's aide in an inner city Chicago hospital. It was shortly after Equal Rights Amendment had been passed, and many women were starting to pursue careers in science that were otherwise unheard of before that time. Several of the older nurses saw my love of taking care of patients and thought of my career in medicine as being a very strong choice and encouraged my endeavor. I did well on my medical entrance examination and was accepted to Northwestern Medical School, which was my first choice. It was at that time that my art professors found out that I was going to go to medical school and encouraged me to pursue plastic surgery. At that time, I didn't know very much about plastic surgery, but I did know that some Hollywood celebrities had plastic surgery and that cleft lip and palates were done by plastic surgeons. But as I further gained knowledge of the different aspects of plastic surgery, the more that I thought that it was an excellent joining between artistry and a science background. Plastic surgery is a specialty that fixes surgical complex problems. Most people think of plastic surgery as being only cosmetic, but my basic volume of plastic surgery takes up a full shelf in my library and is 8 volumes long. It studies different type of complicated medical wounds and congenital problems, and it requires a very long surgical training, which includes 4 years of medical school and 8 years of residency. And during that time, the science aspect of medicine is understood and taught, but the artistic portion of plastic surgery is something that most plastic surgeons have to have that as their basic knowledge base, but not many plastic surgeons have that ability. Some of the different tasks that plastic surgeons perform, such as sculpting misshapen skulls or recreating a breast after a woman's had a mastectomy, taking a misformed, misshaped ear that a child is born with and taking cartilage from a child's rib cage and sculpting the tiny, delicate cartilage framework for an ear is something that the artistry of plastic surgery is evident. Plastic surgery is a very unique specialty in surgery because a plastic surgeon's inner perspective and sense of beauty is very different as it relates from one plastic surgeon to another. My ideal of beauty is that I believe plastic surgery should be very natural. I think it should enhance a woman or a man's body and allow them to have a result that they'll be happy with for years and not look back and regret. I think that it should improve self-esteem and make patients feel better about themselves. Surgery is the time that my artistic background is the most critical. How big to make something, how small to make something, how to shape it, how to sculpt it. That is something that is a part of each procedure that I do. It is a part of how I analyze a problem and in my mind use my three-dimensional abilities in order to recreate it and have an outcome that the patients are going to be happy with. Sometimes I see very unusual results on celebrities, and I wonder what a plastic surgeon was thinking when they over-injected someone's lips or faces and took away really a beautiful, natural facial framework and changed the way that a patient looks. It should never be about changing a patient. It should be about enhancing a patient's beauty. I continued to study art. Initially, during medical school and residency, I had a temporary hiatus in which I stopped my artistic work because of the demands of medical school and residency. But since I've moved to San Antonio, I study at the Southwest School of Art and have worked with, again, figure drawing, figure painting, printmaking, and currently I am in semi-private instruction for pastel and hope one day to have a gallery show in which I can show my latest series of work. Currently I have taken photographs of clothes hanging on a line, and with the wind blowing through the clothes with a different type of lighting, it almost gives a human body type of perspective, and in a way it's a nice way to connect my love of figure drawing with this current landscape imagery. Art has always been a major part of my life. I use it in every day that I work in plastic surgery. I frequently imagine drawings that I'm going to make and what my future pursuits will be. I believe that my scientific knowledge enhances my artwork, and I think that my artwork enhances my science and my plastic surgery.